Good morning. I'm very excited to see you all here this morning. I guess I must have missed the presenter meeting when they were handing out the sessions. And since I wasn't there, I guess that's how I was able to get the 8:30 on the last day of the conference. So I appreciate you being here this morning. We actually ended up at the Red Sox game last night, and my daughter got to walk out and put the game ball on the pitcher's mound. So it was probably one of the coolest experiences. So if I'm a little euphoric, it's because I'm still kind of hungover from that experience. It was pretty cool to be able to see that. My name is Christian Pruitt. I'm with the University of Mississippi Medical Center School of Nursing. And in that role, I'm an assistant professor as well as the Director of Instructional Development and Distance Learning. We have about 850 students across all of our programs, from our undergraduate to graduate programs. Many of those students are in our online programs. And so what we've been trying to do, much the same as many of you throughout the process, is figure out how can we get good content to our students. And how can we shift, because if you've ever been in medical education, which I have not as an undergrad or graduate, I teach in our graduate programs. I teach finance and leadership and organizational management, so I have a business background. But if you've ever watched nursing students, they have to sit through 4-hour lectures in most cases with very little breaks. And while that may seem great to the faculty at the School of Nursing, and we have great faculty, I certainly don't want to say anything against our faculty, that's a long time. And it's hard to absorb that kind of content. So we're trying to find ways to get good content to our students that they could absorb on their own time, and then we can use that class time for different activities. Medical education in particular gives us a great opportunity to have simulations and problem-based learning and team-based learning and diagnostics and problem solving and all these things. And so why waste a lot of that valuable class time delivering content when students can get that themselves? So we had the opportunity to compete, and I'll talk a little bit more about the competition, but just kind of a brief overview of the agenda. We're going to walk through the competition, the steps that we took to create the content, and then the lessons that we learned. And it was really a fascinating process. If you've ever had an opportunity to try to submit something to Khan, I would recommend that you do so, because they put parameters around your entry that we thought would actually hinder our ability to create content. And in reality, it actually opened our eyes to a better way to do things. And I'll talk a little bit more about that as well. So I don't think I need to spend a lot of time familiarizing you with the Khan Academy. Of course, it's a great open educational resource site. The videos are being added every day. A lot of the videos are very good. The content's very good. It's peer reviewed in many cases, so the content is reviewed by an expert to make sure that it's accurate. And really the videos are kind of cool and they're easy to understand. And so it's a great way to take something that's really complex and hopefully provide a fairly simple foundation for understanding the content. And then you have opportunities in many cases for assessment, so you can actually practice the things that you're learning. October 1, 2013, the call came out, and this is what really got us involved in this process. The Jonas Center for Nursing Excellence worked together with the Khan Academy and the American Association of Colleges of Nursing to create this competition that required us to create videos on 2 medical conditions. Now the catch is none of the videos could be more than 10 minutes in length. And so that set out for us a whole new way of doing things, because in many cases faculty like to take the lectures that they're doing in class, and if they're going to do a video, they like to narrate a PowerPoint and keep the content length about the same. So now we had some very strict parameters to work within. So we had to create these 3 videos by January the 7th, 2014. And Khan would then pick the 10 best, or the 10 that they consider to be the best, and those winners would be flown out to the Khan Academy for a week-long series of training on creating these videos. So it was a really cool way for us to try to find a way to get involved with the Khan Academy, because it's something we've been looking to try to integrate into our curriculum for quite some time. And as part of the process, you also had to create 10 NCLEX questions, which the NCLEX, of course, is a licensure exam for registered nurses. So the 3 videos had to be in the following format. The first video had to be what is. So you take the condition, whatever it may be, and you talk in general terms about what the condition is. The second video was the pathophysiology, or what's actually happening at the cellular, organ, or tissue level within the body if a person has this particular condition. And then you also had to talk about ways to treat or to prevent the condition. And then, of course, we had to prepare the 10 NCLEX questions, which thankfully we have a faculty member that helps write some of those questions, so she was a great resource in that particular process. Carl Mangum is one of our leading innovators. As an instructional developer, he's one of the greatest faculty to work with because he's willing to try anything, even if it's wrong. And that's a good thing to do for somebody that wants to try to bring technology into the nursing education curriculum. And Mary McNair is an innovator as well. So as they met together and they heard about this competition, because the call went out to every member of the AACN, which of course our school is a member, they tried to figure out what's the best approach to do this. So they talked for a couple of days among themselves about what they could do. And then they decided, well, we better get somebody here that knows content, layout, and instructional design and can help us sort of figure out the structure and the flow of each of these videos and can advise us in terms of how to write the script or how to organize the videos. And then we needed somebody with AV experience to help us try to figure out the best way to record the videos, the best audio. And regardless of what you may use, we may need some cropping and other video editing. And so Lanny Helton is our media specialist, and he has a degree in film, so it worked out very well that we kind of created this cross-collaboration team, and there were several advantages to that as well. So we decided on anaphylaxis and congestive heart failure. So why did we pick these two topics? Well, one, because Mary and Carl knew a lot about it. Because you really didn't want somebody creating the video or narrating the video that couldn't pronounce the terminology. And as you can imagine, there's some pretty interesting words that I really don't know how to pronounce most of them. And so I'm glad that Carl was there to help us do that. Plus, he kind of has that, you know, that blockbuster video, The Summer, the guy that narrates all the previews and the trailers for the videos that has a really deep voice. Carl has one of those great narrator, let's get ready to rumble, movie creator type voices. So we wanted somebody like Carl who was a good natural lecturer with a good voice. The unfortunate part of Carl is, if you think I have a southern accent, his is just significantly worse. But thankfully, we were able to kind of work that out through the script so he didn't quite sound quite so southern. Not that there's anything wrong with that. And then Mary had a lot of experience because she teaches our Intro to Pathophysiology. So as new students come into our program at the undergraduate level, the first course they take is pathophysiology. And it, as you can imagine, it is an incredible amount of content crammed in a short amount of time. So we needed somebody that really knew the patho behind the different conditions. And once we were done, we had videos that we could use in our curriculum. So regardless of the outcome of the Khan Academy, we were ready to begin to use these videos upon completion. So where do we begin? Well, we tried to figure out what's the best way to do this, so we looked to Salman Khan for advice. As you know, he creates a video that walks you through the tools that he uses to create these particular videos. And then we looked at what we have from a technology standpoint. Now, in the School of Nursing, we've been doing distance learning for quite some time in the old IVN format, the point-to-point using Polycom, connecting to classrooms. So we have a lot of equipment in the school for recording, for capturing audio, for capturing video, but we wanted to figure out exactly how he did it. And it's actually pretty interesting when you watch because it's pretty straightforward and pretty easy to do when you see him do it until you try to do it yourself, and then it changes just a little bit. So how can we take a 4-hour lecture and convert it into basically 30 minutes? That was one of the biggest challenges. Because again, from a faculty member's perspective, content is king. As we heard for those that attended one of the sessions yesterday from another Dr. Khan, content is king. And so they want to make sure there's a tendency to make sure that you include every ounce of content in any lecture that you give. But you can't do that in 30 minutes. So now we need to focus on the things that we need to know. So what do students really need to know when they get through with these videos? And it was actually helpful that we wrote the NCLEX questions first. And then we had something to tie the content back to. And that's something we've never done before because, again, normally the focus is on the content and then you work on the assessment after the content. We actually did it backwards this time. And that actually proved to be a great way to guide us through this particular process. Now, what was interesting about this is Mary and Carl and I are full-time faculty, and Lanny provides support for all of our classrooms in the school. So trying to coordinate schedules among 4 people was pretty interesting. But we were all committed to doing this. So we set aside as much time as we possibly could in the calendar, and we began writing the script. And the reason that we were all involved in that process is because we had to have a series of checks and balances. Because I don't have a medical background and Lanny doesn't have a medical background, if we didn't understand the content, then the hope was that most people wouldn't. So if we could understand it, then a beginning nursing student should be able to understand the content as well, because by the time they get to us, they've had biology, they've had A&P, they've had other courses like that to prepare them. So then we started asking these questions. How detailed do you make the script? Because there's really nothing worse than somebody reading a script. You know it's scripted, it's hard to follow, and I'll show you a video in a minute of what we were trying to avoid. So we didn't want the script to be too detailed, we didn't want it to be word for word, but we didn't want Carl to have to overly think while he was narrating about what he was supposed to be saying next. So how can we keep it conversational with a good flow? Do we use images? And if we do, and how many of you have actually seen some con videos? Okay, good. So you know that there's typically a lot of drawing throughout the process. Well, there are some things that we just didn't want Carl to have to draw, like peanuts and bees and other things, shellfish, things that could cause anaphylaxis. That would have been difficult to try to draw. I mean, y'all didn't hear this from me, but he draws like a kindergartner. So we really didn't want him drawing these particular images because we didn't want people to get lost in the poor quality of the images. So the idea was, do we create new images? Do we use existing images? And we decided to actually do both. So all 4 members were involved in every script writing process so that we could make sure everything flowed and everything made sense. Because for Mary, her tendency was to throw all the big terms. For Carl, he had a tendency sometimes to make it too simplified, and so we had to make sure that we kept a balance because after all, by the time the students were finished with these 3 videos, they needed to be able to prepare for the NCLEX questions that were to come. So we went out, and after watching his example, we already had a campus license for Camtasia, and we bought one of those bamboo tablets. It's about this big, it's wireless, it plugs into your computer. And if you've ever worked one of those, it's really interesting. It's almost, for me anyway, it just doesn't seem to flow naturally trying to use that when you're writing on one thing and looking at a screen. And that created some particular issues. But we did have a lapel microphone, and we used Smooth Draw, which is another one of the recommended programs. But then we also have, in our classrooms, annotators. We have smart boards. We have all different types of equipment in our classrooms. So which ones make the most sense for us to use? And how can we bring these together seamlessly? It's one of those situations where you have a lot of great technology, but there's a lot of moving parts. So how do you figure out how to bring this all together? What we're trying to do is avoid what we call the Bueller effect. And I'll show you a clip in just a second. So what we were trying to do is make sure that the video flowed, it was conversational, it was natural, it had good examples, and yet it didn't just absolutely bore our students to death. And this will give you sort of an overview of what we were trying to avoid.
In 1930, the Republican-controlled House of Representatives, in an effort to alleviate the effects of the, anyone? Great Depression, passed the, anyone?
If you've ever been in any lecture, no matter how good the lecture is, that's a common face sometimes, especially after 2 or 3 hours of lecture.
Which, anyone raised or lowered, raised tariffs, in an effort to collect more revenue.
As you can tell, I'm a child of the 80s, so this is one of my favorite
movies.
movies.
Anyone know the effects? It did not work, and the United States sank deeper into the Great Depression. Today, we have a similar debate over this. Anyone know what this is, class? Anyone? Anyone seen this before? The Laffer curve. Anyone know what this says? It says that at this point,
that's my favorite.
Curve, you will get exactly the same amount of revenue.
So we wanted to make sure that our students didn't end up with that particular condition. We wanted them to actually understand the content and it be useful to them without putting them to sleep. Because let's be honest, anaphylaxis and congestive heart failure, while very prevalent conditions and important to understand, it's just not the most interesting content. And so much like economics with Ben Stein, it's hard to teach this kind of content and keep it relevant and keep the content on a foundation where the students can understand what's happening. So after we painstakingly went through the script several times, several iterations, we decided to start recording. So we decided to copy the Khan method. We sat Carl down in front of a PC in our distance education classroom with Camtasia, with Smooth Draw, and a bamboo tablet. And we went ahead and began the process to start recording. So we wired him up with a lapel microphone and left him sort of captive like you would see Khan. And for Carl, that was very unnatural. He wasn't used to lecturing or talking that way. And so it did create some particular challenges for us. And some of those challenges were him getting comfortable with the tablet. I mean, that's not necessarily intuitive, and it just so happened that the one we bought was really, really small, and that didn't work out very well either. We perhaps should have bought a larger tablet. And he had a limited window of time to understand how to use all this technology, because the call went out in October, we started writing the script in November, and we had to have everything recorded in January. And the way that our school works, we have about a 1.5 to 2 week break between the fall and the spring. And so nobody wants to spend their time recording during that time period. So for that few months, we had to make sure that we took advantage of every opportunity. And trying to make sure that you're looking at the tablet, making sure that you're writing, looking at the screen, trying to read a script, you were trying to coordinate too many different things at one time. And so it was hard for him to keep the tone conversational. It was very jumpy, because he would read part of the script and he would start trying to draw, and then he would get caught up in drawing the images, and he'd forget where he was in the script, and he would have to look back. And so after watching him do this a few times, I mean, after all, it's like riding a bike. It shouldn't be that complicated. But after watching him do it, I began to sympathize with him and realize that I probably couldn't have done that either. So what we decided to do was take a different approach. So we decided to use the smartboard that we already had in the room. Smartboard has a built-in smart notebook that allows you to capture everything that's happening in the smartboard. We still kept him wired up with a lapel microphone, so all that sound was integrated into the smartboard through our distance learning classroom. We uploaded a few existing images, and he still had the opportunity to draw some images, because we didn't want it to be a situation where the reviewers saw all the content as being things that were imported. There needed to be some kind of times where Carl drew things to highlight specific reactions, particularly with anaphylaxis. Plus, it would capture everything. So now for Carl, it's more of an uncomfortable environment, something that he's more used to. Because again, he's an excellent, excellent lecturer, but it was hard for him to sit down and talk to a desktop. So this gave him a way to be able to speak to a classroom as if he was actually presenting. So please forgive the very, very, very cheesy music. I don't know where Lanny got his musical style from. So if you'll just ignore that part for me and just kind of focus on the video itself. The music is a little iffy, but that's okay. This is just a short video to show the process now that we've figured out the best way to do it. And Carl is actually writing on the smartboard now with his finger. And so for him, there's really nothing to coordinate between a tablet, between Camtasia and Smooth Draw. He's able to just do things naturally as he would in a classroom. So phase 2 was a little bit more of a success. Much happier with this particular phase. And after several trials, because Carl's a perfectionist, and in most cases we are, and we knew we would have a group of reviewers looking at the content. So we did have several iterations because there were a lot of uhs and a lot of pauses and that type thing. So it took us a while to get all that smoothed out. But now that the technology was out of the way, he could do whatever he needed to do. And so it made that process a lot better for us. So we recorded all the videos for anaphylaxis, for congestive heart failure. Con asked us to upload those videos to YouTube and send them the links and create QR codes for each video, which we did. And so it was a very cool, very interesting process in a lot of different ways. So now I know you're all sitting on the edge of your seats wanting to know, did our videos win the competition or get accepted? So, without further ado, no. But that's okay. That's okay. We weren't too hurt about that. If you look at the 10 videos, and I think they're out on the Con website now, they were all very well done. And we felt like we were in pretty good company. We felt pretty good about what we had produced. And again, at the end of the day, we do have things that we could take with us. So it wasn't a lost process, because now we have videos that our students can actually use that we've created, and now we have this practical experience with creating these videos. And so we were very, very excited about the outcome. So what did we learn? I'm going to walk through these probably a little more slowly, but I do want to give plenty of time for questions, and I also realize it's 8:30 in the morning, so I'm trying to keep this informative and exciting and energetic, and yet shorter than what you may want the whole 50 minutes to be, to give you time to stretch and process all this great material that you're getting. That was the joke, by the way. Okay. I know it's 8:30, but work with me. So one of the things that we learned is give yourself plenty of time. 3.5 months didn't seem like a lot of time, but it went by very, very quickly. And so give yourself plenty of time, because when you're trying to create con recordings, you have these very tight parameters, because you really don't want to produce large chunks of content. And after we learned from one of the keynotes, the average time spent for students watching video content is about 6 minutes. And we have Panopto, we have a campus-wide license for Panopto, and what we're finding with that is that's about the case. From our medical students to our nursing students to our dentistry students to our pharmacy students, after about 10 minutes you start to see them kind of phasing out a little bit. Or you see them skipping to certain points in the lecture. And so one of the things it's definitely taught us is it's echoed the fact that our faculty, while they may like to do this, and I've seen them do this, and some of you may have experienced this as well with lecture capture, they go back and they try to create 1.5 hour long videos. So we went through, as a part of this process, and recorded a 2-hour video, and we sent it out to all the faculty just to see how many of them would watch it. Take a wild guess as to how many of them even turned the video on. Out of 60 faculty, 5 even looked at the videos, and only 1 looked longer than about 15 minutes. So the point in that was to point out to the fact that, to point out to them that sometimes as faculty we need to treat ourselves as students, and we need to try to experience what they're experiencing. And I've seen faculty literally with 2-hour lectures, 120-page PowerPoint slides that students have to print off and write notes on, and that's really not the most effective way to learn. Especially when, in many cases, in earlier attempts in the school to flip the classroom, that's what they would do. They would have the students watch a 2 or 3 hour lecture and then come to class, and basically repeat a lot of the lecture while they were in class. And then they began to wonder why their student evaluations weren't as positive as they were the year before. Well, part of the reason, of course, is because it was double the workload and there was no additional benefit. So give yourself plenty of time and don't let technology drive the process. I'd like to iterate that again. Don't let technology drive the process. That's the tendency. We try to figure out what technology, and then we sort of adjust ourselves to the technology. And this whole time we were sitting here with this easy-to-use, great way to create content, and we really weren't aware of it. And it was funny because it actually turned out to be sort of a fluke that we used this particular approach. Because one of the days that we were recording with the desktop with Camtasia, our smartboard rep came by and did some preventive maintenance on the smartboard. And when he saw what Carl was doing, he said, "Can I just show you an approach that you might like to use?" So we never even thought about using the existing equipment because we wanted to follow the mindset that we needed to produce the videos the same way that he did. And it takes a village. It really does take a village. Because if you would have watched the video that would have been produced early on by the 2 content experts, it would have just been overwhelming. I don't know that anybody could have really watched the videos and gotten everything out of it that they needed to, because it was one incredibly long word after the other. And I was listening to a keynote at a conference a few months ago, and he made this statement, and his name is Dr. Borden. He works for Pearson. I don't know how many of you are familiar with him, but he made the statement that if you're in a lecture and you say a word that somebody in the audience doesn't understand, you're going to lose the next 300 to 600 words for that person, because they're going to be spending all that time trying to figure out what that one word means. And I don't know if that's ever happened to you, but it's happened to me. So we need to make sure that all the terminology that we use would be familiar, or at least the concepts and the way they were explained. So the what is video is one of my favorites because it's pretty straightforward about what anaphylaxis is, what congestive heart failure is. The patho is a little different, but that's expected because there's a specific purpose behind that one. Video prep is far different than lecture prep. And that's something that's hard for us to understand as faculty. I'm going to put myself in that because I'm a faculty member as well. And I know sometimes faculty members get a bad rap with technology, but there's a lot that faculty have to think about when they're learning new technology. As somebody told me one time, I'm a nurse, I wouldn't expect you to come to the ER and triage a patient, so please don't expect me to walk into the classroom and automatically know all the technology. And I thought to myself, that's fair, that makes sense. So make sure that they understand that when you're doing this video prep, it is distinctly different, because the content, while is still king, has to be incredibly condensed. And not only incredibly condensed, but taught in a way that makes sense. And that was the hardest part of this whole process. Not the technology, not all the things associated with the Khan Academy, but getting the content to make sense in less than 30 minutes. When the faculty that were helping us in this project were used to taking 4 hours per topic to teach it. And so that was pretty remarkable that we were able to get this far into the particular competition. use practical, easy to understand examples. I'm sure you all are familiar with anaphylaxis. So a great way to start the video, instead of talking about anaphylaxis as an antigen reaction to an A1 inhibitor, blah, 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 and I don't really know what most of that means. It's picture a little boy sitting in a classroom that has a peanut allergy and somebody next to him opens a pack of peanut butter crackers. And that particular allergen gets to that student that has the reaction, and he begins to swell, his face turns red, his throat closes up, that type thing. So it's a lot easier to explain if you really think about it from a practical standpoint. And I don't know how many of you have ever been on flights with somebody that had one of these type of allergens, but I've been on one where they've told us not to eat the peanuts that were going to be taken. The flight attendants couldn't pass out the peanuts. They had an alternative that they would pass out because somebody on the plane had a severe reaction or would likely have a severe reaction or a peanut allergy. Or you've seen somebody at a restaurant that eats shellfish or eats something that they're not supposed to be eating. So use practical, easy to understand examples. Because after all, what is the purpose? Well, at the end of the day, for us, the purpose of this is to get students ready to come to class, to then use that class time for something more practical than just lecture. So we want to make sure our students have a good foundational knowledge as faculty begin to talk about this. And perhaps you have a student who simulates anaphylaxis and they fall out onto the floor and you have an EpiPen and somebody's able to go and use the EpiPen or do CPR until the ambulance can get there or whatever the case may be. So we can use that class time to diagnose it, to try to figure out what's wrong, to try to figure out the best way to treat it, to educate our students so when they're in clinic, they know enough about the condition that they can figure out how to treat it. Because we're also still in that mindset of lifelong learning. Because medicine as a whole is changing. For many clinics, many hospitals, medicine is taking on this team approach, where all these different health professionals from these different disciplines are working together. And so one of the other purposes in the Khan Academy for us is across our campus, we're starting to launch interprofessional education. So we want our nursing students to work with dentistry students, to work with pharmacy students, to work with medical students. So we've been creating these scenarios where they get together and they diagnose and they break down problems together. So it's a full care team, even in things like transitions of care, which every healthcare provider would be involved in because that's that moment when a patient goes from them to someone else. So how do you give that handoff in a way that the patients have the information they need to know, etc.? So if we want a dentistry student or a pharmacy student who may be familiar with anaphylaxis to understand the concepts prior to that IPE event, they can watch these videos. And then they come to class a little bit better prepared. Keep it conversational. That was the second hardest part. Some people are just really good at reading a script and keeping it conversational. You know, folks like Nick Cannon and Jay Leno and Jimmy Fallon and folks like that. Us, not so much. Carl, not so much. Because he's used to kind of sticking to a script because he's been teaching these conditions for about 10 years. So for him, it was more difficult to just talk. And that's what made it easier by keeping it in the classroom because I was basically the student. And we actually brought in a couple of students and had them sit in the back of the room so we could completely simulate the learning environment that he was most comfortable with. So again, we weren't pigeonholed into using one particular approach. We were able to kind of work around and navigate it a little bit. Because after all, what's most likely to lose students? Boring content and the Ben Stein effect. And so what you want to do is make sure that you keep the students engaged by, number one, starting out with some kind of example that immediately draws them in that they can relate to. So the first part of the script for us was, how can we start every video with a question or with an example or with something that can draw those students in so they automatically have that foundational associated knowledge that we want them to have so that their mindset is ready as they watch the rest of the video. And they were also comforted by the fact that we did trial these videos with some of our students, and they were very comforted by the fact that for them it was a much different approach to learn. And they told us that they felt like they could come to class more prepared and they would spend more time. Now there's also, of course, this whole philosophy or theory behind pairing this video content with assessments, which is something that we're starting to do. Because we want to make sure that there's not only the carrot for the students to do the work, But that assessment, again, lays a further foundation for when they come to class. So if they watch the video and they're successful in completing the assessment, they're geared up and ready to go by the time they come to class. But if they don't have to do anything, even though it's 10 minutes long, they still may not watch it. So we put it in one of our learning management systems, and we enabled the statistics tracking, so we knew which students watched it, and now we're beginning to pair with the assessments. And the good thing about this particular process is now we have NCLEX types questions to pair the assessments to. The videos to. So now they have to think like they would be thinking if they were taking the NCLEX. And the NCLEX is a very interesting exam. It's not like most exams because it requires you to problem solve. And so instead of just asking basically what is anaphylaxis or what is an allergic reaction or what is an inhibitor or what is this, they actually have to work through different scenarios. So this gets them ready by the time they reach their senior year to prepare for the NCLEX. Focus on the needs to know. That's tough because there's so much to know with congestive heart failure and with anaphylaxis. So again, how do I take this and get the right content across in less than 10 minutes? So you do that by saying, well, if NCLEX were to ask questions about these conditions, what would those questions look like? And then as you begin, Dr. Northington, who helped us write these questions, who's our NCLEX expert, by writing the questions, that made it a lot easier for us to do this. So while it may seem like we were teaching to the test, there was a purpose in that. Because at the end of the day, we want our students to pass the NCLEX when they take it. We don't want them to spend their last 2 years of college, their last 2 years of their professional school and not pass the licensure exam. So we wanted to make sure they were prepared for that. And of course, begin with the end in mind. So let me show you very briefly. This is one of the earlier iterations. So please forgive the cheesiness of it. It got better over time, but I don't want to bore you with all the details. Let me flip this over.
Hello, everyone. My name is Dr. Carl Mangum, and I'm with the University of Mississippi School of Nursing. I'm here today to talk about anaphylactic shock.
You won't have to watch the whole 8 minutes, don't worry. We'll stop at the 6-minute mark because I know y'all will start dropping out after that.
It's an allergic reaction, basically. A person has developed antibodies to a certain antigen they've been exposed to, and that causes the reaction. This reaction can happen almost immediately, sometimes just in seconds. Other times, with certain reactions, it may even take hours before they develop. There are common things out there that cause these type of reactions and anaphylactic shock. First, let's talk about food. One of the most common are peanuts. Other nuts,
this is one of the early attempts, so you could tell he was very nervous and he was reading
milk,
primarily
eggs,
from the script.
Soy, wheat. So there are a lot of different areas in food that can cause this type of reaction. Insect stings would be the next one. Bees, wasps, hornets, yellow jackets, ants, including fire ants, any type of insect that can inject venom carries the possibility of creating anaphylactic shock. Next are medications. Several different types of medications, including antibiotics, vaccines, chemotherapy, are just a few examples of medications that cause this type of reaction. And also latex. In the healthcare field, we have to be mindful of this because many of our tools, including our gloves, contain latex. As with anything, you need to make sure that the person you're working with, your client, you have a good understanding of any potential allergic reactions they may have, whether it's food, medicines, latex, insects, whatever the case may be, so you can help try to prevent that. Next, let's talk about some of the signs and symptoms.
Wonderful guy, wonderful lecturer, draws like a
person may
kindergartner.
have several of these at varying levels of severity. The skin, if it's been...
Okay. So as you can see, that was a phase 1 of the process. That was the first time we'd really ever started using the smartboard. And so it got a little bit better because the way he made the revision, is the next time we shot the video, he talked about a time where his wife took clindamycin, an antibiotic, after a visit to the dentist, and she had an immediate reaction, and he had to rush her to the emergency room because her throat was beginning to close up. So as you can see, that set the stage immediately for students to say, okay, I can relate to that. I understand what that means. And so the videos got much better over time. I think we've been going about 35 minutes, so I'll stop here and take any questions that you may have, unless you just want to watch more of the videos. I have plenty if you'd like to watch those. I'm not seeing a lot of... okay. Don't all raise your hands at one time and bull rush the stage to watch the videos. But this was really, just kind of in closing, this was really a great process for us because it set these parameters that helped us reshape the way we thought about recording videos. Because we thought about going with the big blue button, and we thought about the one-button studio. We thought about setting up ways and areas in our school. And the reason we've been kind of hesitant to do that now is because after going back and seeing what faculty were recording, which were basically narrated PowerPoints replicating the lecture, now we're getting them to think about how can I draw this out and illustrate this and talk about this in a more practical way. So it was a really great experience. Yes, ma'am.
So you mentioned before that he was a little nervous when he was reading, and I know that many faculty members just aren't very used to this type of thing, talking on being recorded, I guess. So is there, and we know that it tends to be better in general if they're a little more like not reading. So is there any coaching that you do, or is there anything that you found that works to get them to move from the script to, is it just experience?
Well, really the best thing that we did was ask some students to come in that had never heard the lecture before and put them in the room so he could talk to them. It was a little frustrating for them, admittedly, because we did about 5 or 6 takes that particular time. So by the 6th take, they were sick of anaphylaxis and congestive heart failure. But it was helpful in that sense because then, as a lecturer, you typically don't have the script. The hard part for the faculty is they have their security blanket or their PowerPoint, so they have all their talking points. So what we did is we took the script and we kind of taped it next to the smartboard on the wall, so we had it kind of as a backdrop, but it was mainly bullet points so that he didn't spend a lot of time having to look, but it gave him a transition. And so what we would do is when our videographer, after the recording started, he would kind of leave things where they were, and he would go up and he would, I don't know if you heard it, but he would actually kind of take the script, it was on a sticky note, and he'd pull it off and to the next page so Carl would know the transitions. So it kept him from having to hold a script and read it. Yes, sir?
Could we see a video that's a little more polished than the one you just showed?
Sure. Let me show you this one on the, and again, these are, if I can go back to where I was. All right, let me. Well, I probably should have put the links in here, shouldn't I? That would have been helpful. And I'll show you the patho because it was probably the harder one. Even though the first illustration looks like strips of bacon if you are not used to looking at it.
Hi, I'm Dr. Carl Mangum with the University of Mississippi School of Nursing. I'm going to talk about anaphylactic shock, in particular its pathophysiology. Anaphylactic shock is a type 1 hypersensitivity response that begins when a sensitized individual is exposed to an antigen, whatever the antigen may be. A widespread reaction through the body occurs when between the antigen and the IgE antibodies on the surface of the mast cells, and to some extent the basophils also. Large amounts of vasoactive substances are released, causing systemic vasodilatation and increased capillary permeability. Now let's go in further into this and see how it really acts. This is an example of a mast cell. You see the antigen and the IgE antibody there reacting. Now let's talk about some of the mediators that are released during this time. The first one we're going to talk about is histamine. Now, histamine is a potent vasodilator, resulting in significant reductions in blood pressure when released in excessive amounts. It also causes bronchial constriction and mucus production. So it causes several things. The next one we'll briefly talk about is leukotriene. Now, leukotriene causes smooth muscle constriction, bronchospasm, and contributes to increased vascular permeability. The next one is bradykinin. And in bradykinin, it contributes to the vasodilatation also. Are you starting to see a theme of what we're talking about here with the vasodilatation? And the last one we'll talk about is the prostaglandin E2. Now, prostaglandin E2 also contributes to that vasodilatation and increased permeability. Now, what does all this do to the person? Well, let's take a general person here. We'll call him Stick Man. And what happens to him during this? Well, many things. Vasoconstriction.
So you started out with the very complex, explaining what the antigen was and the inhibitors and all that, and now he's saying this is more a practical understanding of what we just talked about.
Difficulty speaking. There's also, that also affects the lungs when that happens. So they're not able to move air and get oxygen in and out, in and throughout the body.
Again,
also, there's gastro.
We'll continue to get better
that may happen
with the drawings.
May be nausea, vomiting.
And what we're actually probably going to start doing
like
is
that.
involving our biomedical illustrations team so they can come in and draw some of these to make it just a little more official looking. Yes, sir.
Does the video have to be done at the same time as the audio? It seems like it would have been more smooth to do one and then the other, to marry them together.
That's something we've definitely talked about, and the reason that we didn't do it this time is because of the timing, because we'd have to shoot all the illustrations and then make sure we timed all the audio clips. But moving forward, when using biomedical illustrations, that's what we're going to end up doing. Let the illustrator watch the video and then go back and narrate the video and then just pair the two together. Yes, sir.
Do you know if quality control or authenticity or accuracy control that puts on videos that they submit, or can they put somebody else in place, correct?
No. Typically with the Khan Academy, and I'll use this as a particular example, they had 2 physicians and 2 nurses review all the content for the videos to verify its accuracy. And Khan usually does a very good job of making sure that somebody within that particular area looks at all the content and makes sure that it's accurate. So it'd be tough to just go and upload any video. They do screen the content ahead of time. Yes, sir.
If you're creating these as an additional study aid, as a way to kind of further cement concepts, which is really what Khan Academy is about conceptually, it's one thing. But if you're trying to use this to kind of flip the classroom and you're talking about, using substitutions, the fact that it takes a village becomes a bit of an issue because it's resource intensive to create these for your courses. And I've found if content is king to a faculty member, the faculty thinking he or she can do it best is probably queen. Have you had success in getting one faculty member to use another faculty member's video that you've created with the group? Because the desirability of investing the resource and creating good videos is kind of proportional to how many of the faculty you can get to use it, in my mind.
Right. And we actually did. Because this content flows throughout the curriculum, so they'll hear these examples multiple times, we were able to be successful in getting other faculty. The problem that we're going to run into long term is exactly what you've mentioned. We have a lot of great faculty. We have some that feel like they can do it better than anyone else. But at the same time, what a lot of our faculty that feel that way discover is if they try to do it themselves, it's too much work and it's too complicated. So if somebody else can create the content and I can then use it and build upon that, then I would rather let somebody else do that. And so we're expanding our team to try to add more resources to be able to create more of these videos. Yes, sir.
To what extent do you intend to continue to introduce this style of video content into your curriculum, and what portion of your faculty has expressed interest in getting involved with this?
After watching the videos, seeing the simplicity and hearing some of the student feedback, about 25% of our faculty. And those are the same faculty that are going to be more open to trying new technologies and new ways of lecturing. The harder part for us is convincing faculty how to effectively flip the online classroom. So changing the mindset from these longer lectures to these short video bursts. They're already beginning to see the research on how that improves student learning and helps students get better prepared. But B, getting them out of the mindset of, I walk into a classroom and I start lecturing. So one of the things that we're doing in the school is all of our lecture space, we're completely changing the flow of our lecture space so that it's no longer set up like this. So faculty then can walk in and have the option to say, where do I stand? They're going to ask that every time they walk into our classrooms long term. And so I think that will help with this process as they really begin to understand the buy-in of flipping the classroom, because I'm trying to be very careful in how I say this, but sometimes faculty do feel like that people come to school to hear them. But yet the reality is more and more faculty are realizing that there are a lot of video resources that can deliver the content more effectively than I can. So if I'm going to continue to be successful in this role, then I need to understand that I'm actually playing more of a role in the flipped classroom because I'm more the mentor, the coach, and I'm doing more one-on-one teaching than lecturing. And so that concept is slowly starting to make its way across our faculty, that they realize that this kind of technology is not replacing them, but it's actually making them more effective, and also causing students to say, I want to go to that particular school because I'm going to get an experience there that I can't get anywhere else. So it's going to take time. I'm not optimistic that in the next year all of our faculty will be ready to start doing this, but hopefully over the next 3 to 5 years we'll see a pretty significant increase in the volume of these videos that are being created, especially as we work around some best practices to make this process more efficient. Yes, sir.
You talked about the compression of topics like anaphylaxis down into 10-minute chunks when they might take 4 hours normally. Was there any discussion of creating sort of a video series, so rather than doing one 50-minute video that incorporated all of it, or even one 10-minute video that tried to incorporate all of it, that you could sort of chunk it up in such a way that would allow students to move through it kind of at their own pace and to feel like they had definable goals that they were meeting along the way?
Yes, that's going to be phase 2. Now that we've kind of gotten through this and we've seen that it's effective and it can work, we also realize that in and of itself, 30 minutes is probably not enough, even with some of the in-class activity to prepare them with all the terminology that they'll need for NCLEX. So we'll definitely have to break this down into longer streams. Yes, sir.
How do you decide what needs a video? What topic?
Well, I guess for us, well, number one, we had a rush time schedule, so for us, we had to pick videos, content that our faculty were most familiar with. But for me, I think the one thing that we're really beginning to take a stronger look at in the School of Nursing is we're looking at our learning objectives, our mastery of the learning objectives, and our NCLEX prep, and we're going to identify those topics that the students tend to struggle with the most, and that's going to form the foundation of these particular videos moving forward. Yes, sir.
What is your security model on YouTube? Is it unlisted, or does the faculty have a problem with it being on YouTube?
Well, for this particular competition, we had to make it public because those were the specifications of CON. But what we've seen with our faculty is they're creating their own private channels, making it unlisted, and only putting the links within the learning management system. So we offer both protections. Yes, sir. Yes, ma'am.
In the videos that won, what did you learn from their videos?
Well, number one, they had a cooler background. This is the white background with the beautiful illustration. Some of the ones that won had the black background that looked more of the light bright look that Khan Academy was more used to. And one of the things they kind of dinged us on particularly was this video, because a lot of the terminology was still too complex and it would have been more difficult for people to understand. So after getting that feedback, they gave us suggestions on how to simplify it a little bit more. So we learned a great deal, actually. Any other questions? Yes.
Sort of a side connection. With your work or your knowledge of Khan Academy or maybe other publication sources and the concept of these things being reviewed or even peer reviewed, have you or maybe anybody in the audience found places to do this that the results of these things, besides being useful, are cited or useful in the faculty review process in any fashion, of having a publication that's of a certain level in video?
I better defer to the audience on that too, to kind of have some background. Most of the research on this is pretty anecdotal. A lot of it is from Khan itself. minus the new research that we're seeing about the flipped classroom. But what we are doing, and I'm glad that you asked that particular question, is what I'd like to start doing is conducting some real actionable research on these videos now that we're actually starting to use them in the curriculum, and then they would lead to publications. But more than that, there's usually, with most promotion and tenure guidelines, some educational creativity in there that I don't think we get enough credit for. We tend to focus just on how many points from how many publications. And so I'm working with our faculty promotion and tenure committee to see if we can change some of the guidelines. So as you create some of this and you get some actionable research out of it, then that goes towards some of your promotion and tenure as well. So that's going to be, I'm afraid, a losing battle, but I'm going to try to fight it anyway. Because there needs to be more of a carrot for faculty than just students learn this. I know this is going to sound interesting, but you know, it's great that students learn more this way, but for the faculty that's investing the time and resources, they're also thinking about their publishing, their tenure, and promotion. So if we can actually begin to integrate this into the curriculum and get some real statistics from it, then that can help us. Yes, sir.
Yeah, what have you done to redesign the course flow when you flip the class? Because now you have kind of an unnatural event in the physical class. I mean, do you have a sort of a redesign methodology, and how do you actually test the workability of it? Do you have some test panel, pre-launch? Just kind of curious how you do that.
Well, what we're starting to do with it, in particular with a lot of this, is we have a group of about 4 members of our curriculum committee, and we also bring in students, and we bring in students from other disciplines to take a look and verify the accuracy of the content. And then as we begin to roll this out, and we're really going to start digging into this more in the fall, where we actually have course redesigns, based upon using this flipped approach, so that it can become part of the curriculum and we can develop specific student learning outcomes that they can display both in their assessment and also in a clinical situation. So they'll have to take some of what they're learning here and apply it in our clinical skills lab. Yes, sir.
Are there more con submissions in your future, or are you going to concentrate on content for your institution?
A, focus on more content for our institution. B, hoping it leads to more con submissions. Well, for an 8:30 session, y'all were a great audience. Thank you very much. I appreciate it.